What is eczema and what are its symptoms?
Eczema is a very common condition. Up to 20 of children worldwide suffer from it and experience significant discomfort. It typically begins in early childhood, around the age of 2 or later. Eczema is often associated with allergies and autoimmune disorders, which occur when the immune system malfunctions and begins attacking the body's own healthy cells. There are over 100 known autoimmune diseases, including rheumatoid arthritis, psoriasis, and vitiligo, among others.
Are these diseases similar?
In many ways, yes, they share a common underlying mechanism. The immune system mistakenly attacks healthy tissue. Autoimmune conditions can affect various organs and systems throughout the body. When the immune system targets the skin, specifically the outermost layer, the epidermis, it can lead to eczema.
How can you tell if it has eczema?
Eczema symptoms can vary widely, both in appearance and in where they show up on the body. It is sometimes mistaken for psoriasis, but there are key differences. One distinguishing feature of eczema is the presence of fluid-filled blisters on the skin's surface. Other common symptoms include persistent itching, dryness, redness, and inflammation. The itching can be especially intense at night, causing emotional and physical distress.
Is eczema curable?
Traditionally, eczema is considered an incurable condition. Standard treatments often include antihistamines and topical or oral antibiotics to manage flare-ups. However, at our clinic, we take a different approach. Instead of only suppressing symptoms, we focus on restoring and strengthening the immune system using natural regenerative therapies. We offer a treatment called FOP filtration, ozonization, and photobiomodulation of the blood. This cutting-edge procedure is one of the most powerful and effective treatments available today, not just for eczema but also for a wide range of conditions, including allergic reactions, severe intoxication, sepsis, kidney failure, post-stroke recovery, viral and bacterial infections. Patients often experience noticeable improvement the very next day. After just a couple of weeks, many report that all visible symptoms have disappeared. The treatment plan is always personalized. Some patients may need more than one session, but often a single 45-minute procedure is enough. It might sound miraculous, but it is real, and we're very proud to offer this innovation here in Georgia. The FOP procedure was recently introduced in the United States and is gaining popularity there, even for general immune support. While it hasn't yet become widespread in Europe, we imported all the certified equipment and products directly from the US. We're highly selective about our medical tools and technology. For us, treating so-called incurable diseases in just 45 minutes is a real, tangible goal. Eczema isn't just a medical issue, it can also affect a patient's mental and social well-being. People often feel self-conscious about their skin. That is why it is important to emphasize, eczema is not contagious. Like other autoimmune diseases, it cannot be transmitted from one person to another.
Does clothing or diet matter?
Yes, absolutely. Patients should wear breathable, natural fabrics, preferably cotton, to avoid irritating the skin. It is also advisable to avoid dairy products, as they can trigger flare-ups in some individuals.
When should you see a doctor?
It is best to consult a doctor as soon as symptoms appear. Diagnosis typically includes a physical skin exam and a blood test to check for elevated levels of immunoglobulin IgG, which is associated with allergic responses. Standard treatment often includes prescription ointments, which may bring temporary relief. However, it is important to understand that these are not cures, they only mask the symptoms. At our clinic, we address the root cause of eczema. Once the immune system is rebalanced, the symptoms disappear and the disease itself begins to recede.